Good evening, Mr. Haynes. Good evening, class. I'm Cadet Murphy, and today I will brief you on the Neurologist Air Force Career, or AFSC 44 Nancy X-ray. More specifically, we will look at four things: a neurologist's purpose in the Air Force, what is needed to become a neurologist in the Air Force, the responsibilities of a neurologist, and what is expected from their career. One of the responsibilities is to recognize early symptoms and use methods and technology at their disposal to treat diseases through medication, rehabilitation, and physical therapy. They also need to be highly trained to perform examinations, recognize the signs and symptoms of underlying illnesses and diseases. They also need to be able to diagnose and treat diseases that affect the brain, spinal cord, and peripheral nerves that result from injury, diseases such as epilepsy and multiple sclerosis. They lastly need to be able to recommend methods of treatment, whether it be through physical therapy, lifestyle changes, dietary restrictions, and therapeutic methods. And here we'll be talking about their qualifications. They need to have a Doctor of Medicine or Doctor of Osteopathic Medicine degree from an approved medical school. They also need to have completed their residency or have current enrollment in the neurology residency program. They also need to have completion of a 5.5-week commissioned officer training course, and they need to be between the ages of 18 and 48. Their responsibilities include supervision, so they need to be able to supervise medical technicians and serve as a consultant on electroencephalographic apparatus and other neurological diagnostic and therapeutic equipment. They also need to be able to keep records of patients and ensure patients' privacy, and they need to maintain cleanliness, so they need to keep their areas sanitized by washing their hands before and after examinations and wearing PPE. And they also need to be able to have accurate info, so they need to obtain and give accurate diagnostics and information. Additionally, neurologists need to be able to carry on tasks such as examinations. They need to be able to examine a patient and determine the need for clinical laboratory tests. Furthermore, they also need to interpret examinations discoveries and apply the examination discoveries to the test results in the laboratory. They also need to coordinate with other neurological devices and with other medical activities. They also need to use their equipment, so they need to supervise medical equipment and ensure that the medical equipment is being used appropriately. And they also need to formulate plans and procedures for neurological services and perform detailed examinations on all patients and determine appropriate actions suitable for each individual or airman. Sir, today I briefed on the Neurologist Air Force career. We looked at the purpose of a neurologist, the qualifications needed to become a neurologist, what a neurologist is responsible for, and what is expected of a neurologist in the Air Force. Sir, this concludes my briefing. Are there any questions? Thank you, sir, and have a great evening.